A woman got married in a hospital room hours before brain surgery. Her name was Clayson. After 15 years together, Clayson knew their future had suddenly become uncertain. Anne was preparing for surgery for a brain tumor, and neither of them knew what the next chapter would bring. So, Gary proposed. What happened next was not a story about a medical breakthrough, artificial intelligence, or a billion-dollar healthcare investment. It was a story about people. The healthcare team at Advent Porter in Denver helped transform a hospital setting into a wedding celebration. Nurses and caregivers stepped beyond their routine responsibilities to create a moment of joy during one of the most frightening moments of Anne's life. Then Anne went into surgery. This story stayed with me because it reveals a truth healthcare leaders often overlook. Patients do not remember healthcare as a series of procedures. They remember moments. They remember the physician who took extra time to explain. They remember the nurse who offered reassurance. They remember the person who treated them as a human being, not a diagnosis. Here is the uncomfortable question. What if the biggest threat to compassionate healthcare is not a lack of compassion, but a lack of compassion? Most physicians did not enter medicine to spend their evenings fighting administrative complexity. They chose medicine to help people. Yet every day, clinicians lose valuable time to documentation, billing challenges, workflow inefficiencies, and tasks that pull them away from patient care. That burden does not stay inside the practice. It reaches the patient. Less time for physicians often means fewer conversations, less connection, and a weaker patient experience. This is why administrative efficiency is not just a financial issue. It is a human issue. Healthcare has spent years asking, how can we make healthcare faster? The better question is, how do we remove unnecessary work so healthcare professionals can spend more time doing the work only humans can do? Technology should not replace the human side of medicine. It should protect it. The future of healthcare will not belong to organizations with the most software. It will belong to organizations that create the most space for physicians, nurses, and caregivers to care. Anne and Gary's story reminds us of something simple. Medicine is not only about treating disease, it is about honoring life. The question every healthcare leader should ask, are our systems helping create more moments like this, or are they quietly making them harder to achieve? I would love to hear your perspective. What administrative burden takes the most time away from patient care in your practice? Share your experience in the comments. If this resonates, consider reposting to help other physicians and clinic owners rethink how operations, technology, and workflow design influence the human side of healthcare.